My name's Larson, and I'm a person in recovery. I'm also the peer support coordinator here at RHD. So I am not only the president of the men's hair club, I'm also a client. It just makes me feel better. Sorry about that. I digress. One of the things that I'd like to talk about is basically this idea of flexibility that we've been talking about all morning. The spectrum of services that it really takes to embrace this idea of recovery. We had Matthew speak eloquently about some of the frontline services that are really necessary up front, just to prevent, just to sustain life. I also want to talk about the spectrum of services that are provided, that have been provided to me over the years, that have really made not only mental health recovery part of the equation, but community recovery and career recovery. That we can stabilize mental health services with medication and therapy and services. But if I tell you my 20-year journey with schizophrenia and hearing voices, that if I had stopped there, I would have been nowhere. I would have been dead in prison, just as Matthew suggested, that those services are a continuum of a larger need. And I really like the way we've been using language to talk about universality of this mental health experience and the things that we're challenged with, and not looking at it as something that a portion of the population deals with, but rather as a human experience. So flexibility and choice are huge not only in the beginning stages when we're talking about stages of change and how people make decisions in their lives to recover. We look at that continuum of a person's recovery path. We're really looking at services that need to mentor somebody side by side, shoulder to shoulder. And this happened to me in my recovery. I started out very simply looking at services, day program, clubhouse, therapy. But my transformation really happened when I started to see that I could have purchase into not only being receiving services, but also being a part of the community. And that really requires some really strongly valued people that can look past the times when I'm going to volunteer for a job and I have to sit in the parking lot because I have diabetic concerns, and I sleep for an hour and I miss an appointment. And somebody that can look past that and say, okay, we're going to give you a second shot. Because that's what recovery is really about. It's about reintegrating into the community and second chances. And if we're really talking about that, we're looking at programs that are progressive. And when I mean progressive, I mean we need to think about when we're stuck with fiscal challenges and we're looking at budget cuts. We really look at how we spend money. And we really have just begun this idea of transformation over the last 10 years, really. And we're really just starting with where we've come to approach that tipping point or that critical point that we've looked at. And I think if we look at services and how we've learned about what helps people, the progression of services need to include a lot of different ideas, that they can't be one size fits all. For instance, there's many programs, and I'll cite some specific programs. The consumer movement is sought to look at the leadership and look at what we can do and mobilize. And I think this budget cut thing is, if it's done one thing good, it's gotten us angry, which is a motivating force, and how we can get together and solve some of these problems that aren't getting handled because of service money being cut. Programs like Compere, the Consumer Reinvestment Fund, Friends Connection, which is a peer support coalition, even the Pennsylvania Pennsylvania Mental Health Consumers Association and the Peer Support Coalition of Pennsylvania have seen cuts. And these are progressive services that are really at the tipping point of how consumers, when we come back to the table and are ready to contribute and really be part of this movement and kind of create and outline the services we're going to have, these services, unfortunately, I think, are looked at as extra because they're not the services that address crisis. They're not those services that address when something really bad happens. I think those kind of services are the ones we fund. And it's interesting, we fund those services. We might spend $15,000 for a crisis, somebody in crisis for a couple of weeks, put them in a state hospital. But if we're looking at consumer reinvestment funds and stuff, and if we're really having this conversation about what really works and helps, I don't know about you, but I'd rather take that $15,000 and go on a cruise than spend that time in a state hospital. And I think that's much more therapeutic. So if we're really having this discussion about what is more effective, we really have to look at these more progressive ideas and not just isolation of crises and restraint medications. That's only scratching the surface of the ways we can affect change on the health system. I think as our peer leadership has the potential to transform, mobilize this historically kind of forgotten population. And I encourage everybody, if we're thinking about hospitalization and crisis services, to look at a website regarding the Memorial for Recovered Dignity. It's really a compelling statement. We looked at how, as a population, we've just been kind of put out there and forgotten and for a lot of years. So this transformation is really just coming to a head. So budget cuts are really, unfortunately, churning away some of these programs that I mentioned that are really progressive and that can help people without these more costly interventions. So as a recovering person and a provider of services, I just want to thank you for your partnership and kind of arguing, this argument that we need to preserve our humanity, stay human, and just simply providing a wide scope of services and not one size fits all. Thank you.
Sure, thank you. Thank you.